Hello friends, today we are going to discuss one question from pharmacology. So the question is drugs, which are the drugs or you can say antibiotics that can be used in the treatment of anaerobic infections. Okay, so anaerobic infections are caused by the anaerobic organisms. There are many anaerobic organisms like Bacteroides fragilis is there. Then there are a Clostridium group of organisms which can cause anaerobic infections. So to treat these anaerobic infections, there are some 7 to 8 uh, drugs uh, that can be used. So first one is the penicillin. In penicillin, the drug that is used is the ampicillin plus beta lactamase inhibitors. Ampicillin plus beta-lactamase inhibitors can be used in the treatment of anaerobic infection. The second group is cephalosporins. Cephalosporins in the second and third generation can be used for the treatment of anaerobic infections. The drugs are the cefuroxime, cefaclor, and cefoxitin. Okay. The another drug for the treatment of anaerobic infection is the clindamycin. Clindamycin can be used for the treatment of anaerobic infections. The next one is the infections caused by Clostridium difficile, and for the treatment of these Clostridium difficile infections, the drug that is used is the vancomycin. Okay. The another drug is the chloramphenicol, which is used for the treatment of infections caused by Bacteroides fragilis. The other drugs that can be used is metronidazole. Metronidazole is a nitroimidazole group of drugs, and it is used in the treatment of infections caused by entamoeba histolytica, like amoebic liver abscess or extra intestinal diseases, or intestinal amoebiasis. Then the other drug is carbapenem, and particularly imipenem can be used for the treatment of anaerobic infections. And this imipenem is given by injectable route only; it is not available by oral route. Okay, and the last group is the fluoroquinolones. Not all the fluoroquinolones are used for the treatment of anaerobic infections. The drug which is used, the fluoroquinolone that is used in the treatment of anaerobic infections is moxifloxacin. Okay, the other drugs are less commonly used, but the moxifloxacin can be used for the treatment of anaerobic infections. Okay, so I have enumerated almost 8 drugs for the treatment of anaerobic infections. So if I enumerate it, first one is penicillin, second one is second and third generation cephalosporins, then vancomycin, after that metronidazole, then imipenems, moxifloxacin, chloramphenicol, and clindamycin. Okay, so these are the 8 drugs that are used for the treatment of anaerobic infections.